Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
So today we're going to do a short video on Little League elbow.
Is that like when you break your arm and you can throw like 100 miles an hour like that movie?
Yeah, I don't ever saw that movie. What movie is that?
Some kid breaks his arm and then he goes to the Cubs and they win the World Series.
Cool. No, it's about the sore elbow in those Little League baseball players.
Okay, very common problem, especially it seems as kids are playing more and more of sports.
Yeah, right. So you've got your young athlete, maybe he's into pitching or he's doing a lot of throwing and all of a sudden his elbow starts hurting. So what's going on? What are one of the things that could be going on?
So he could have Little Leaguer's elbow or apophysitis.
Okay. Right, so let's try to understand what it is. To understand what it is, we have to discuss what the difference is between an adult bone and a kid's bone.
Size?
Kids' bones are smaller, yeah,
okay.
But they're growing.
Okay.
So they have growth plates on the end of them. These growth plates are called the Apophysis, or the physis is the growth plate, the epiphysis is on the other side of the growth plate, and the metaphysis is the part of the bone that's on the main part of the bone.
And they're made up just of cartilage and bone rather than just bone, and that's what allows our bones to get longer and us taller and your arm to grow.
Right. So it's this physis where the problem happens with Little League elbow. Now in kids' bones, where the growth plate has a tendon pulling on it, sometimes they're referred to as the apophysis instead of epiphysis. So that's why Little League elbow is a form of apophysitis.
So inflammation of the apophysis.
Right. And it occurs right on the inside of the elbow. So the medial epicondyle, that bump on the inside of the elbow, is the part that hurts in these kids that get Little League elbow.
So what I was going to say is, how old are the kids that are getting this problem? Are they 5 or are they 17?
I think first of all, they've got to have open growth plates.
Okay.
So they're probably in boys younger than 14 to 16, girls younger than 14. And I mean, I usually see them in kids that are around 7, 8 years old and up from there.
Okay. And they're coming in with pain like when they're asleep at night or during activity or right after? Or?
When they're throwing.
During throwing, okay.
So they're throwing, and then after a while, their elbow starts to hurt.
Okay.
And it gets to the point where they just can't throw anymore.
Okay.
And sometimes they're able to throw a few throws before it starts, or some kids, as soon as they start throwing, it starts hurting.
All right.
So it's that medial epicondyle that gets inflamed right at the growth plate, and it occurs because as a kid's throwing, he's putting a valgus load. So a load in this direction here, you can imagine the ball's here. So there's a lot of muscles tugging right on that little piece of bone right there and repetitively tugging. So I tell them it's like when you take a paper clip and bend it and bend it and bend it and bend it, eventually
it's going to break.
It breaks. So you have these little micro fractures in the growth plate that occur after repetitive throwing movements.
Okay. So once you have pain there, what do? You go to your family doctor?
Yeah, usually you pinch your family doctor or the trainer, the team trainer. And the kid will say, hey, my elbow's hurting, it hurts when I throw, it hurts when I throw.
Yep.
The dad's usually saying, get back out there and throw another 80 pitches.
Okay.
But generally it's your body's way of saying, hey, I got to stop this activity, I got to stop temporarily, I have to stop this throwing motion.
So before we get to treatment, so history, physical examination, so it's going to be sore to touch.
Right.
And then in orthopedics, we always get an x-ray. So is the x-ray going to be normal?
Most of the time the x-ray is normal. Occasionally you can see some irregularity at the growth plate in advanced cases, but usually the x-ray is normal. But we like to get the x-ray to rule out any other bad thing that could be going on in a kid's bone.
Sure. Okay, so now that we have a normal x-ray, we've confirmed that this kid throws a lot, maybe too much, and that's obviously an important topic for discussion. What do we tell the parents now as far as treatment? Okay,
so the mainstay of treatment for Little League's elbow is rest.
Okay.
Stop the throwing for a period of time. You have to stop it. Kids' bodies are great. They can heal. They can heal just about anything. But you have to let them heal, and that involves resting or stopping the game.
Okay, so I'm super competitive dad, saying my kid is the pitcher. We're going to the playoffs. Okay, my kid rested this afternoon. We got a game tonight.
Okay, so that's not long enough a rest, I don't think.
Okay.
I think I'm talking more on the order of days or weeks, depending on how long it takes for the pain to go away.
Okay. So again, I'm going to play the devil's advocate. So we wait a day, and then, so do I get my kid to try a couple throws and see how it goes then? Is that the litmus test for being cured?
I kind of customize treatment to where the kid is in the season. Like, I mean, if a young player comes in with a sore elbow, at the very beginning of the season, I'll say, look, let's rest it for a good couple of weeks, then reassess. And send them home for 2 weeks. You can hit You can run the bases.
You can field.
You can field. Just no overhand throws for a couple of weeks. Come back and reassess. If the pain is gone and everything's good, then you can get back into it.
Okay.
If not, then we try again for another 2 weeks. And in addition to the rest, I often will do some sort of rehabilitation or physiotherapy with that.
Okay, and then symptomatic treatment like Tylenol, Advil, potentially some ice?
Yeah, or mostly I use a topical anti-inflammatory in these young guys or girls.
Do they ever need surgery?
Very, very rare. I've never seen that required. I've read that can sometimes come to that. I've never seen any child that needs surgery for Little League's elbow.
Okay, and the main culprit, we have to say it. Why is it happening?
I think there's three main risk factors.
Okay.
One, the competitive athlete.
Yes.
Two, playing one sport all year round.
Yep.
And three, playing all year round.
So overdoing it in general.
Overdoing it, basically, yeah. One sport all year round,
Yep.
very competitive. Those are the three main risk factors for getting Little League elbow.
Okay, so take home message, your kid's a thrower, has a sore inside of their elbow. We're gonna be properly assessed.
Get it assessed, get the x-ray, rest it.
Okay.
Make sure you adequately rest it, and when the pain is gone, then you gradually ease back into the throwing sport.
And be prepared to back off again. It might take one or two goes at it.
It could take a few goes at it. And a lot of leagues now have pitch counts that restrict the number
to
of throws.
protect the kids.
But those pitch counts don't often count the warm-up before the game, the warm-up before the pitching starts.
Sure.
So there's often
Another
a lot
30
more.
or 40 pitches with it not even counting.
Easily. I see a lot of the kids doing the long toss before the game too, and if you have a sore elbow, back off. So kids, if you're watching this, if you're playing baseball and your elbow starts hurting, tell the coach right away. Coaches, if you're watching this, check every week. Anybody's elbow hurt, anybody's elbow hurt. If the elbow hurts and you catch it early enough, the rest period is much, much, much shorter.
And parents, if you're watching this, don't push your kid if they have a sore elbow. We'll get them to play a whole bunch of different sports. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own elbow.
See you next time.